Well, good morning, everyone, and thank you all for joining. We're happy to say that we're at the very end of this cycle of working with the Georgia Flex grant. We're so thankful to the State Office of Rural Health, Dawn and Amanda, for giving us this opportunity to work together. So we're going to move through some slides right quick like because we do have three presenters today. So I want to give them all the time so that you all can learn from each other. Our agenda stays the same as what we're doing, and the biggest thing today is that we're going to hear from each other. Uh, I'll just reintroduce myself. I'm Melanie Brown. I'm the lead for this project, and we'll continue on as we move forward. We're going to change from today of talking about, we've been talking about social determinants of health for about a year now. Well, really over a year now, for a couple of years. And so we're going to change up starting in September. We hope that you all will continue to join us and think about who you need to bring to the table. We will start talking about safe use of opioids. And with safe use of opioids for the beginning, I do have an outside speaker to join us. I think that they're going to bring to you a program that is available in Georgia for you, especially for those of you that are Joint Commission accredited. They've got some tips for some things that will help you meet some of your measures. And so hopefully everyone will continue to join. At times, we may ask you to bring either your pharmacist or your medication management folks on. So we'll take care of that as we go along. But this morning, I want to preserve time for those that are presenting. We have, again, three great presenters, and we're going to start with Selena Stone of Liberty Regional Medical Center in Hinesville, Georgia. So, Selena, the floor is yours. If you will unmute, please, ma'am. And good. Selena, we're having a hard time hearing you.
Oh, hello, everyone. Can you hear me now?
We can hear you now, yes.
All right. Yeah, my name is Selena Stone. I'm the Director of Infection Prevention and Employee Health here at Liberty Regional in Hinesville. I'm excited to join you all today. We're going to talk about our hospital action plan and how that we've tried to conquer some of these health inequity that we're noticing in our community. So the first thing that we did was establish our goals. And the goal was through data collection and evaluation that we will provide an innovative health service for our patients experiencing food insecurities. And we're also going to provide this innovative, ethical, and respectful health services for patients experiencing transportation issues as well. So we wanted to hone in on food insecurities and transportation issues. Now, we were able to identify these goals through our China project was a big driver in our strategic plan. Our China is our community health needs assessment. We just now did a complete revision with Vicki Lynn Scott, and we noticed that food insecurities and transportation were among the main issues. We did narrow in on some data as well of who is targeted specifically. But with the China project as well, we were able to expand our resource directory. So that was something that we had developed over the last few years. And it is essentially a booklet that we hand out to patients that are flagged for certain issues. Now, this book contains resources for a lot of things: mental health, child care, how to get like healthcare access, insurance, TRICARE, things like that. But there is a portion of transportation resources and food insecurities. It lists it out in detail. It says what the place is, what hours they're open, here's the phone call, here's who they serve. So, we're not just providing them with one option, we provide them with a lot of options in the local area.
So Selena, if I could stop you just a second. So you actually give out a book with all this information in it. Okay. And just so to clarify for everyone, I'm sure a lot of folks know where Hinesville is, but you are serving you mentioned TRICARE, so you are serving Fort Stewart folks, correct?
Yes, so we have Fort Stewart here with, and that's Wynn Army Hospital, and then as well as, we do Ludowici, which is Long County, down into Gum Branch, and Hinesville. And then all the smaller inner towns and stuff in that area. So transportation, of course, when it comes to rural healthcare and getting access to that is always a challenge. And yes, the people in Hinesville are okay, but we've really seen the people that are outside of the city limits, the county limits, things like that, that are actually having really transportation issues.
Thank you.
So handing out that directory really helps. We've laminated them, and we've also handed them out in the community as well. All right. So then how we do this, our action plan and steps, is we collect data and then evaluate the number of patients that test positive for experiencing food insecurities. So that any person 18 years and older is screened initially upon inpatient. And if they do screen positive, then, we have different organizations that assess with food securities. We just have to get the information to the patients, which I feel like the pamphlet or the directory, as we call it, the resource directory has been really beneficial in doing that. Like, for example, we were able to partner with some joint food drives in the area. We had someone that was on our perinatal unit, and her husband was recently unemployed, and she told the director that, they were worried about feeding themselves when they get home and their child and stuff. And everyone always thinks of the baby and stuff, which you should, but we have to think about the whole family. So we were able to actually, with a local food bank, arrange for the meals to actually be delivered to their house, so that they, for about a week or so, so that they, didn't have to worry about that, and they could get their, comfortable. But if we would have never asked those questions, then, we would have never known that this was going on at home, because a lot of people don't really speak up. We did see that our data consisted of 328 total patients, and ended up being about 5 people with food insecurities, and they were from 31 to 80 years old. So not really a trend there. 6 were transportation issues, so that's a total of 18% pretty much total that either had food or transportation issues. And the age on the transportation was 32 to 94 there. African American people, that they said that we nailed that they said that they had more food insecurities, and older individuals over 65 and older had more transportation issues. But it ends up with all that it could be about 33% of the people that you're seeing coming in inpatient has food or transportation issues, is what we've kind of, and then so now to focus on the transportation, we've had that in progress. And like I said, 15% of inpatients, we've kind of said that they need assistance, and 18% need transportation assistance. But we have noticed that it is extremely difficult to get the transportation needs met, because we've noticed that a lot of these people, the patients that come in that have transportation issues, need also help getting in and out of their home. They need help when they get home. So we have been really working very closely with our utilization management and case managers to, try to line up some things. But really, that's all that we had really. We did do Backpack with Buddies as well in the school system to get that, population of children served as well. So we're trying to go out in the community and, let them know that Liberty Regional is a place that you can come for resources. And if we don't have it, we can at least point you somewhere that we can help you, so who can help you.
Well, thank you. Sounds like I've got a lot of things going on. And again, as we talked about last month, the diversity in our state. So you serve a totally different population in a sense because of the large base there in your city that encompasses a good bit of city. And you have a lot of manufacturing going on around down there too. So a lot of opportunity. So any questions for Selena this morning? And Karen and Hannah, I cannot see the Q&A box or chat. So I did see where someone had asked a few minutes ago if the slides were available, and the link is in chat for the slides. Any questions? Thank you, Bonnie. So, you can see in the chat, Selena. All right, well, we will move on for the sake of time this morning. Selena, we thank you for presenting and letting us know a little bit about Liberty and Hinesville. So we're going to move on.
Thank you very much.
And Hannah, you may have to help me out. There we go. We're going to move on up in the little bit of northeast part of the state to Wills Memorial Hospital in Washington, Georgia. And this morning, Angie Radford will be presenting for Wills. So Angie, the floor is yours.
Okay. Good morning. My name is Angie Radford. I am the Director of Nursing here at Wills Memorial in Washington, Georgia. And next slide, please. Little bit about us. So Wills Memorial is a 25-bed critical access hospital. We operate 19 med-surg beds. We're a little bit unique in that we do have a vent trach swing bed program here. I think we're probably one of 3 in the state who do vent trachs on our swing bed program. We have 2 rural health clinics. We have a very outpatient as far as PT, OT, speech, have a good outpatient base as well. On our med-surg floor, we do admit inpatient, observation, and swing patients. So for this project, our health equity statement is to improve overall patient health outcomes and reduce healthcare disparities through data-driven health equity interventions and quality service. The picture that you see there is a picture of our new advanced wound care center that opened in August of 2024. We've actually grown that program, and it is now open 2 days a week and is doing quite well. So I'm very proud of that. All right, so for this project that we did, in 2023, we had no formal screening process for SDOH. We were collecting real data, but we really weren't using any of that information. We were just collecting it. So in 2024, with our inpatient admissions, we had a total of 111 inpatient admissions. And we were able to screen 83% of those patients using the AHC screening tool. We're on Cerner, and that is the screening tool that we opted for. So for SDOH2, we looked at the SDOH insecurities. So in 2024, 20% of our total patients did screen positive for SDOH. 5% of those, I actually had 2 or more insecurities noted. And you can see that we didn't have any positives for housing or interpersonal securities there. So in breaking down the different insecurities, for food insecurities, our we had 7% that screened positive for food insecurity. We were actually able to break this down by race and gender as well. We felt like that would give us a little bit more information, so we were able to break each one of the SDOHs down into that, so you can see that breakout there. For utility insecurities, 9% of our patients screen positive for utilities. And as you can see there, it's evenly across the board as far as race and gender. I thought that was pretty interesting. Utilities is something that everybody has to pay for, and everybody across the board that screened positive, it was, race and gender, pretty evenly split there. And transportation insecurities, that of course was our highest, and we knew that. We've known for a while that we've had some issues with transportation, but 10% of our patients screen positive for that. And if you look at the race breakdown there, 78% of the African American population screen positive. Of the ones that screened positive were African American, 78% of those, and 22% were white. So we definitely have some transportation issues in our area. Okay, so we were able to do the SDOH1, SDOH2, and so we, in doing this project, we wanted to look at our inpatient readmissions. So for 2023, of course, like I said, we weren't doing any formal screenings for SDOH, but we had 139 total inpatient admissions, and our readmission rate was 5.75%. So in looking at these readmissions, we came up with a goal, and our priority population was the African American patients with a respiratory diagnosis. Now, when I say respiratory diagnosis, that's a combination of respiratory failure, pneumonia, COPD, CHF. So those are, all of these patients in 2023, even though we weren't doing any formal screenings for SDOH, they all had documented issues with transportation. So we knew that was going to be a big issue. So in looking at 2024 inpatient admissions, this is just simply a breakdown of our admissions by race. You can see that they're pretty evenly split for 2024. It's 58% and 42% there. So in 2024, our inpatient readmissions, we did have 111 total inpatient admissions. Our readmission rate did increase to 7% in 2024, but like I mentioned, our goal was to focus on the readmissions of our African American patients and conduct best practices to prevent readmissions. So in doing this, our overall readmission rate increased, but our priority population of the African American patient with a respiratory diagnosis decreased. So I thought it was also very interesting that none of our 2024 readmits screened positive for any SDOHs.
And do you have any idea what happened?
I just know that they did not screen positive for that, but we're going to look at some readmission comparisons next. So,
okay.
All right. And this is a comparison here of 2023 and 2024. We did have a decrease in our priority population of African American male readmissions. This is just the comparison there from 2023 to 2024 there. So here's the readmission diagnosis comparison. So readmissions for a respiratory related diagnosis did decrease by 25% from 2023 to 2024. 62% of our 2023 readmits were respiratory related, and in 2024, that decreased to 37%. Okay, so interventions. These are simply things that we did that we feel like helped. We were able to screen all of our patients for SOH using the AHC screening tool. That we're proud of being able to work with Cerner and get that. As most of you know, when you're working with an electronic health record, it's not the easiest thing to get changes made and things going, but we were able to get the screening tool done for 2024 so that we could screen our patients. Our social worker consults, we have a social work consult on all of our patients being admitted. So if they're inpatient, if they're observation, or if they're swing bed, our social worker sees every patient that's admitted to the hospital. That way they can start the discharge process from the beginning of day one, and they can not only look at the social determinants of health, but they can also start working on any equipment or anything that they may need in the home that they may need some assistance with. One of the things that we also did was all of our respiratory diagnosis patients were referred to our pulmonary rehab program. So we have pulmonary rehab as an outpatient service, and our medical staff agreed to allow my case manager, utilization review person, to make referrals on all of the patients who were admitted with any type of respiratory diagnosis. This way, they would have help once they were discharged from the hospital to hopefully decrease those readmissions. They would have that pulmonary rehab resource to work with them. And I think that was extremely helpful in decreasing the respiratory related diagnosis readmissions. Our providers, we're a little bit unique in that our providers that admit to the hospital work in our rural health clinics, and they see their own patients. So most hospitals have hospitalists. We don't work off of that model. Our primary care physicians see their own patients in the hospital. And I think that as a result of that, they realized that a lot of these patients do have transportation issues. They do have things going on that don't allow them to be able to come into the office. So they've been able to make home visits for patients who either can't get into the office for transportation reasons or whatever the case may be. They've gone out and made home visits to these patients, and I think that that's been extremely helpful. First of all, it cuts down on the social determinant of health for transportation, but it also cuts out readmissions because they're actually being able to be seen by their primary care physicians.
Angie, could I stop you there just for a second? For these home visits, so the physician are actually going into the home, or do they have extenders that go out to the home?
We have both.
Okay.
So we have primary care physicians and we have nurse practitioners. For the most part, it's been the primary care providers that are going in. It's, I think that the extenders have been in the office, and the providers have actually taken it upon themselves to make the home visits.
Very neat.
Yeah, it's a little unique. It's certainly we have some very good, caring primary care providers that they're extremely they take care of their patients for sure. I mean, they admit them to the hospital, they see them in the office, they do it all. And like I said, we're unique in that we don't have hospitalists here right now. So We also created a social determinant of health resource sheet with the help of Alliant. We used their form and we were able to fill in the local resources. And so our social worker gives that out to the patients who screen positive for SDOH. And that way it gives them a resource that, that they can look back on. So it's actually a piece of paper that she's given them that gives them the information about transportation or food or utilities, whatever the case may be, whatever they're screening positive for. All of it is on one sheet. So even if they screen positive for one and maybe didn't screen positive but maybe are having some issues with it, they'll have that information as well. We also increased our telehealth services on our inpatient population. So we do a very robust telemedicine program with Augusta University, WellStar, MCG, whatever we're calling it these days in Augusta. We do a big telehealth program with them, and they work extremely well with us. It has allowed us to be able to keep some patients that maybe are a little bit sicker in our hospital and in our service area, which has been great for us and the patients. The patients, they're from a rural area and they're not really excited about having to go to Augusta, and some of their family can't. Transportation is an issue. There's so many different things with that. So the telehealth program has definitely helped us with that as well. And we have also increased our use of our local transit, and we have one Uber in our county now. We're a very small county, but the one Uber we've been able to use several times, and it has been helpful for us as well. Okay, so our health equity project wins. We were able to collect and report on SDOH1 and SDOH2 this year, so that's been great for us to be able to do that. We did decrease our African American readmission rate by 21% from 2023 to 2024. Our SDOH positives had no correlation on our readmits in 2024, so we feel like some of the interventions that we did on the previous slide were a result of that correlation not being there with our readmits and our SDOH positives. So certainly we want to continue with the initiatives that we've done in the last year. We've reduced our respiratory-related readmissions by 25%, so we're very proud of that. And we're in compliance with Joint Commission and the National Patient Safety Goal regarding health equity. And we recently had our Joint Commission survey, and that went well. We actually had to show them this project, and they were pretty impressed with that. So
good. So, and you had everything together. That, I think that was a good thing. And your reductions that you have done with your pulmonary program, probably not everybody has the opportunity to have that, but I think that this shows that obviously it's working. And I'm glad to see that you all have one Uber in the county. So it's probably hard to identify how you found that one Uber. Can you elaborate on that just a little bit?
Actually, the Uber came to us.
Okay.
So that was, we were not aware, but we are a very small community. But the person that is doing the Uber, she came to us and said, I'm offering this service if you guys ever need that, if your patients need that. So we were able to add that to our resource sheet. And we've actually used it that I am personally aware of twice already this year. So, it's there, it's available. Not all of our patients, of course, can afford even an Uber, but we do also have a local transit that we use that is very affordable. So that has helped as well.
That might spur a little bit. Just think about, I'm not sure exactly. I know how to find Uber in a large town. I just don't know if it works. If you have an app on your phone, you might do a little search right quick, like, and see if one's out there. Because if it's in Washington, Georgia, who knows? It may be in an area near you. And
That's right.
so at least you were able to find that, and it's filled a gap at least twice this year. So that's impressive. So I think this is your last slide. Is that right, or you got
It
one more?
is. It is.
All right.
That is
Do you all have any questions for Angie? All right. The slides will be available, so you all can download them and contact each other if you want. Well, Angie, thank you so much for presenting this morning from Wills Memorial. And at this time, we're going to travel back over to the southeast part of the state. And if you all can't tell after these presentations and all, Georgia geography is something that in the travels that I've done with Alliant, I kind of got to, I wish I had known this in the 8th grade of where all the counties and everything were. But I love maps and I love to travel about the state. So today, for our last presentation, we're going to go down to Bacon County, which is probably about an hour from Hinesville, but more southern, getting closer to the coast. And so, Jenny Johnson, I'm going to turn it over to you to do your presentation.
Good morning. I'm trying to turn my video on, but it's disabled by the host, it says. Is that the way you want to keep it?
All right.
Can you hear me?
Host, we can hear you just fine. And
okay, that's fine. No, ma'am, that's fine. Like you said, my name is Jenny Johnson, and I am representing the Social Determinants of Health team here at the Bacon County Hospital this morning. Thank you for this opportunity, Miss Melody.
Thank you.
We named our team Samaritans of Society, the SOS team. I was clicking on this. Did you enable it now?
Your camera is on, yes.
Okay. So anyway, this is a picture of our hospital. We're very proud of it. And we sent out our group that picked the name, and we voted this in, the SOS team, which is the Samaritans of Society. And we have worked really hard. We are a 25-bed critical access hospital, and we are one of the few left that does labor and delivery, general surgery here. We have cardio, stress test. We also have a vascular surgeon on staff, an ICU. We have the swing bed program, sleep center. We also have attached to us Twin Oaks Nursing Home. Is like 80 beds, 81 beds according to staffing. Bacon County Community Care Center, we have two different rural health clinics. We also have South Georgia Physicians Group. We have a ABC Child Development Head Start program that's linked with our health system as well. And like Miss Angie, we have an outpatient pulmonary rehab that a lot of our local people use, as well as a rehab center that we are able to refer our patients to outpatient therapy.
All right. And Jenny, if you need me to change slides, let me know.
Yes, ma'am. You can go on over to goal 1, which is the next one. Next slide.
Okay.
Goal 1 was developing and improving the process to meet community needs of our uninsured population. We noticed the 3 top needs in our community. The first one being they were uninsured. After we added the questions that was recommended by CMS to, we are on Meditech, and initially we were asking every patient that was admitted to the hospital, but then we drilled down to inpatients only, and we, through our China assessment and our questions, we identified that our community was at a 19% of uninsured here, that, they just didn't have health care insurance. And so they were using our ER a lot. So when we met together in one of our meetings that I went to, I had the opportunity to meet up with a lady that told me about this insurance broker that was being the middleman and helping these people get signed up with Marketplace Insurance. So that was one of the things that we put in place, that if you come to the hospital or to one of our clinics, we educated them about the opportunity for marketplace insurance, because a lot of them, if you got your Medicare age people that can get online and get Medicare and be set up with it, but then you got your working generation age group that if their if their employer does not offer insurance, then they're in the gap. So we linked arms with an insurance broker that helped. We asked the patient, hey, are you interested in talking to somebody about getting insurance? And if they said yes, then we had them sign a little waiver. We sent it to him, and him and his team would follow up with the patient and get some information and tell them what was available to them. And that has been very successful. We, on an average right now, we make approximately 50 referrals a month to him, and the sign-on rate that he is helping these people with is about half of that. So we feel good about that. We've also added, to help with the patients presenting to the facility, we've added additional staffing after hours and on weekends to assist with signing up with the indigent care or the presumptive Medicaid. Or we also live in an area where we have a lot of seasonal migrant workers. And so our staff has been trained to assist the patients to sign up with emergency Medicaid for these mothers that are coming in and having babies. So we had a baseline that was admitted of 12% of uninsured. And the goal was that we wanted to decrease it by 5%, and we were able to meet that and exceed that at a 7% rate. That was a process that we put in place, and it is continuing to be ongoing. It's been good for us. And there is going to be some changes. I don't know if everybody is aware or not. I'll take this opportunity. We've met with the insurance broker, and at the end of this year, marketplace insurance, you're not going to be able to sign up all year long. It's going to move toward just like a regular insurance. You can only sign up during open enrollment, which starts in November. It is income based. It's for these people that's fallen in between the gap. They're not old enough for Medicare, and they do not qualify for Medicaid. So according to your region, your zip code that you live in is how they have the companies that are offering a marketplace in your area. So like I said, these people can sign up at the end of the year unless you have a life-changing event, just like a regular insurance, like a death or a marriage or a child being born and that kind of thing. So he keeps us informed with that, and we're going to continue that process on through next year. Next slide.
And Jenny, before we go, will you say those dates one more time, just so everybody can kind of
it starts in, yes, ma'am. It starts in November. If you sign up in November, you will have insurance January 1. If you wait later, I think the deadline is December the 12th to be able to have active insurance the beginning of January. I can follow up with the exact dates on that, Miss Melanie. I can send that information to you, and you can send it out if you would like.
All right, I sure will. Just so everybody has that on their radar screen.
Yes, ma'am, because, you've got those people that are working, outside or in jobs, small businesses that do not offer healthcare insurance.
And again, your community is a bit unique because you do have the migrant farm workers, but we have all over the state. So, for those of you that might have that opportunity.
And those names and people that are in billing, they'll recognize, Ambetter is a big one in our area. Blue Cross did offer one as well, and it took a little while for everybody to work the kinks out with that. But those are the two that's in the Bacon County area. There's a Care Source too as well, I believe. But anyway, we are seeing claims be paid by those, and it does offer some of the people that go out early, say like if you want to retire at 62, you're eligible for Social Security, but you're not eligible for Medicare yet. So there's that gap. We've learned a lot through working with that process. Goal number 2 was to educate and increase awareness of behavioral and mental health needs and resources available in our community. The reason we chose this is because when we started our social determinants of health education, we held a mandatory education here at the Bacon County Hospital, Quality Speaks, and we had been to an in-service as well. And the China assessment, we had like 3 different backgrounds of where we had gained information. And in that, we learned that depression and anxiety was, really high in our area. And so right on the heels of COVID, so what we did is we took this opportunity to, number one, pour into our staff and to their families. We are one of the largest employer in Bacon County. So we took this opportunity, and if you'll look at the slide, through the Flex Engagement workshops, we was able to link up with family resilience training and adolescent behavior. We held workshops that was available for the staff and the community. We also gave 2 different first aid classes. One was for adults and one was for youth. Now, this is mental health that was given to our community and our staff. We did what we call, that was offered, it was a brain game, and what that consisted of was you drew a deck of cards, and through that deck of cards you would pull out events, life events, trauma, different things that our people are exposed to, that children are exposed to when their brain is being formed. And they came out and spoke on the program HOPE, which is healthy outcomes from positive experience. And even though what we've learned through all of this is, even though the children or the staff or the community has been through this trauma, if you've got that one healthy, positive person in your life, you can overcome it. So we went on to educate. If you look down at the bottom of that slide, we educated our staff. We held employee health fair. And then through our community health needs assessment that we do every 3 years, in 2022, substance abuse, which is a big problem everywhere, ranks number 1. And there again, that causes, breakdown in families and your staff, etc. Then in 2025, it ranked twice after the education that we put out into the community. And when I say that we put out, we held these classes, and we had youth pastors come, we had pastors, we had representatives from the sheriff, the local law office, the sheriff's department. We had the lady from the Magnolia, Magnolia House, where the women go when they are scared and have no place to go. It was just a wonderful, wonderful experience. You can show the next slide.
So Jenny, while I'm changing slides, you're offering this to the community, and the community actually is really coming out and participating, it sounds like.
Yes, ma'am. It was a outpouring. I was just amazed at, we got with our cafeteria and offered lunch. and invited these people. We had 3 different classes that we held, and every class that we held was a different group of people. Ministers, people from the Board of Education, local youth pastors, the law enforcement, representatives. We gave our ABC daycare employees an opportunity, our staff an opportunity, and through all of this, it was just you'd never know what people's going through until you all get in one room.
That's right.
And you get that, you go through and you play this game or you're asked these questions, and then the next thing you know, somebody is just opening up to, oh yeah, let me tell you what happened to me when I was a kid, and then, like I said, it was right behind COVID, and everybody was traumatized at some level. And now we've added these questions to all of our admission assessments. We put them into our clinics, and this is a picture of the brain game that we did with one of the classes, and everybody just learned so much through that, and how we can all be overcomers, Miss Melody, with the right resources and the right people in our life. Goal number 3, developing and improving processes to meet food insecurity for admitted patients. When we first started this project, we were all assigned a group. I don't know if you remember that, but it was through Alliant, and Bacon County Hospital was assigned to a group of 5, which was the food group. And so we developed resources that was, we linked arms with the local food banks here. In 2024, 27% when asked the questions of admitted inpatients showed a food insecurity of some sort. So we reached out to our local food banks, and in doing this project, it kind of forced you to explore your resources to see exactly, hey, what do we have in this little small town? What are people doing? Because and through that, we learned how much churches in our area was like, hey, we do that. We have this. We just need a name. We just need to, give us who they are. And naturally, you have to ask the person, are you willing to, do you want help? Are you willing to let these people help you right now when you're in this spot in life? And in doing that, we did build the resources with the Bacon County Senior Center, Area Agency on Aging, and then our local church support and our local food bank. And our rate was decreased down to 18% for food insecurity. And that's been a good outcome for us. Now, what we've started doing, next slide, we put this in place, the whole team did.
And Hannah, if you could change the slide. Thank you. This
is what we have in place on every discharge. If you'll take your phone, too far. There you go. If you'll take your phone camera and hold it up to that QR code, everybody that's on, you can hold your phone up to that QR code, and it will go to findhelp.org. And all you have to do is enter your zip code, and it shows you all the resources available in your area. Did anybody have any trouble with that? I tried it again on my phone to make sure it was working. This goes out with every patient we discharge through the ER, inpatient, observation. Whenever you get discharge instructions, this prints out with every discharge that we do. The one on the bottom right-hand corner, is where our case managers document if the patient showed that they fell in the social determinants of health gap, that they needed assistance, or even if they did not. This is where our case managers, the patient's admitted to the hospital, they're assigned a case manager. We don't have a social worker on staff. So every one of our patients that's admitted to the hospital is assigned a case manager that assists in the needs that they may have and educating them on their diagnosis and DME supplies, home health, all the above. This is where we document what we did and the resources that we put in place for them. And that's why when we come up with the, voted on the name, we just felt like we are the hand extended to help our community. And that's how this title, just automatically rose to the top, Samaritans of Society. And we put that little picture on the globe up there because that's what we do, and loving on these people and helping them because that's what we do.
Very good. Well, Jenny, thank you so much. I think that you hit the nail on the head for this whole project. And that is exploring opportunities. And I do remember when we divided you all in groups about a year ago, actually. I think September would be a year ago. And, we were learning. We were learning from you all, and you all were learning from each other. But I think it did give you the opportunity to really start looking outside of your brick and mortar walls of what all is around you. And just from the 3 presentations this morning, and additionally from all that we've had presenting since April, y'all have done a wonderful job. Fantastic job. I know still Dawn is actually on vacation this week from the State Office of Rural Health. And I'm not sure, I can't see who all's on, so I don't know if Amanda's on. But the one thing I can say is that the state of Georgia has really, really done a great job. You all have done a fantastic job with looking outside, exploring opportunities, and then being willing to present and learn from each other as we were ending up this year. I want to keep this momentum going as we do switch. You have done a great job. I think you can take the lessons learned from the social determinants of health, and as each of you this morning alluded to, we're going to move over to safe use of opioids. I think we can take the same opportunities and apply that to safe use of opioids, and how you can look at mental health. And again, I do have a presentation lined up with some outside folks in September to kick us off, and just thinking in a different way, because honestly, I heard the guy speak, and he mentioned something, and I had never put opioids together with what he talked about. And I'll talk about that a little bit more when we get into September. But again, we're going to learn from each other, and we're going to learn, what everybody's doing and medication management and how we can bring that in with your MB-QUIP measures. So I'm looking forward to that. But any questions for any one of our presenters this morning, for Jenny, Selena, or Angie, before we move on and wrap up today? Well, again, Jenny, Selena, Angie, y'all did a fantastic job, just like everybody else that's been reporting out since I believe we did the first report outs in March or April. Great sharing. This is where we really have had the opportunity to bring you all together and you all learn from each other. I'm just going to go through slides right quick like, because I know that we are at the top of the hour, or getting close to the top of the hour. I've left this in for one last time for your MB-QUIP measure sets, version 2.2. And I do see Amanda's on. Amanda, I'll stop right here. Do you want to say anything before we go today?
I just wanted to say, that's okay. I just wanted to say I agree with you. Everyone did a great job today, and it's been really eye-opening, and I think everyone's done a great job over the course of this past year. I've just enjoyed being a part of it and listening to all the work and how well everyone's worked together, and I'm just excited for the upcoming year and our new projects. So.
And Amanda, I think you'll agree with me that Georgia is really on top of this and doing a great job.
Yes, I totally agree. I agree.
And we thank you all from the State Office of Rural Health for this opportunity to bring this to the critical access hospitals in the state.
And we are proud to be able to do it, and we are proud that Align is here to work with you all. Y'all have done a great job.
Well, thank y'all. So we're going to move on. We got about 3 minutes left. Again, I've added in the measure descriptions, your deadlines for submission. Just go through who your numerators and denominators are, but some of the information, make sure, because we learned a lesson as we began with social determinants of health and health equity, though we don't say that anymore, but we learned lessons of what were the exclusions. So you'll have the slides, and I've listed out or got listed for you the exclusions. I do need to know, again, if you could drop in chat or just send me a message after this is over, or however you want to do. For safe use of opioids, I want to know what your challenges, barriers, and needs are. And the most beneficial thing that would be for you to assist with the measure as we move forward. That would give me opportunities and ideas of what to bring to you. And if I need to go out, again, I do have a speaker in September, but if I need to go out and find others, that'll just kind of give me some good opportunities to really give you what you need back. So again, drop it in chat or either just send me an email if you don't mind. Last but not least, we're going to show this one last time. It doesn't mean that you stop this. You keep doing what you're doing. You've all got things set up and you're learning and you're knowing about your communities. We won't need this anymore because we're moving on. And in September, on September 23rd, we're going to do our kickoff for safe use of opioids. And I want to get down. Always know that our website is available for you, the same place that these slides are coming from, the slide set today. Everything that we've done for the past couple of years is listed on this Georgia Flex website for Alliant. And we've got your 3 resources. So make sure, as Jenny said a few minutes ago, the QR code for findhelp.org, that was something that we introduced to you all early last year. And I hope that you've been able to use it, but I think an effective use too. Jenny, as you all said, you put it on your discharge information. And again, as I said, starting in September, we will continue the same schedule, the 4th Tuesday of each month. And September's a little different because as I look on my calendar, we do have 5 Tuesdays. We will be on the 4th Tuesday of each month at 10 a.m. Eastern time. And I think we all are in Eastern time zone. But 10 a.m. Eastern time, 4th Tuesday of each month, and we're going to kick off the safe use of opioids. So we're right at the top of the hour. I want to thank again Jenny, Angie, and Selena for presenting today. Amanda, we want to thank you all from the State Office of Rural Health, and we look forward to switching gears and going into safe use of opioids in September. So you all have a great rest of this week, a great rest of the month, and join us back in September. And if you want to bring others from your teams, please be sure to include those that might be using or in part of safe use of opioids. Thank you all and have a great week.